However, what we have found based on the literature is that if you start early, if you get your recommended daily intake amount, in your 20s, 30s, 40s and beyond, you're essentially preventing aspects of the disease that are risk factors and can initiate the cascade of pathological burden that you see in these specific disorders. So in my lab, we've published a few papers in rodent models actually showing two phenomena. One, if you don't have choline in your diet, it increases, it leads to obesity, it leads to liver pathology, it increases plaques and tangles in the brain and neuroinflammation. That's if you don't have enough choline, right? Or don't have any choline in your diet. The opposite is true. If you supplement with more choline, you actually reduce the amyloid beta and the pathology that you see in Alzheimer's disease. However, it has to start pretty early.
Yeah, yeah,
If you try to use it as an intervention where the pathology has already began,
yeah,
kind of like it's too late, right? It might
yeah.
help. It might help with aspects of metabolic function. If someone has diabetes, we actually are working on a study right now where we're touching on aspects of that, and we can get back to that. But the evidence does show that it needs to be done throughout your life to truly have profound benefits in the prevention and also in healthy cognitive aging.
Mhm. Yeah, so the name of the game here is prevention, and that makes sense. Like from a nutritional standpoint, if you're getting adequate nutrition, your body will be able to do the things it needs to do, and be less likely to develop pathologies. But at least in the case of something like Alzheimer's, when you've got tangled microtubules and proteins in your brain, you're not going to get rid of those most likely if you simply start taking something that you're already deficient in for a long time.
Exactly, 100% correct. So I'm a big advocate, and I share this with everyone when I give these talks that this is established and recommended by the Institute of Medicine since 1998 when they first established that it contributes to fatty liver disease. So everyone should be taking it, right? It's not going to hurt you. I've had questions about, hey, what happens if I take too much choline?
Right.
You need to take approximately 8 times the recommended daily intake amount to have toxic effects. The two toxic effects are typically low blood pressure, and you start to smell like a fish because of the metabolite that occurs. Yeah. I mean,
Wow.
not very bad side
No,
effects, but I
no,
will
but
say,
hey, that at least tells you that's a clear marker of like, oh, hey, I can back off the choline.
yeah, but getting close to 4 grams of choline a day
That's a
would be
lot.
that would be very difficult to do, right?
Well,
Most supplements and tablets that are out there usually give you about 250 milligrams of choline. Yeah.
yeah. So you can literally target the recommended dosage in the 400 or 500 milligram range or so, and then you could just go above that to be safe a little bit, and you'll be fine.
Right, yeah, and we've actually done a few studies that have tested. This is in rodents, but there are studies that have been done in humans, and I'll talk a little bit about those as well. That we typically go at 4.5 times the recommended daily intake amount, right?
Hmm.
Which is still not very close to the 8 times, right? And we find pretty drastic benefits in terms of cognition, reductions of neuroinflammation, reductions